Hey, this is Eva with Teens in the Driver's Seat Teen Advisory Board. Thanks for attending today's session. Here are some tips to help make this session a great experience. We are committed to saving lives and reducing crashes on our roads and request each participant commit to connecting to our event from a safe location. Please do not connect while driving or operating any form of machinery. First, notice the panel to the right with several tabs. Here is where you can chat, ask questions, retrieve handouts, and see answered polls. The chat is public and you are encouraged to say hello and answer any prompts that appear there. If you have questions, post those in the Q&A window. Any handouts can be downloaded from that tab, and finally, poll questions will appear directly on your screen. The presenter invites questions. Type those into the Q&A window anytime. The prize drawing for a $50 gift card will be held at the end of the session. Make sure you stay on for that. Finally, at the conclusion of the webinar, please complete a very quick survey for this session, which will help the presenter and us improve in the future. Enjoy the session! Hello everyone, my name is Eva Ellenberg from Pepper High School, and today we're going to be showing you clips from different safe driving activities in our community. So first of all, we have the TVOC program. Now TVOC stands for Teen Vehicular Obstacle Course, and is something that many of our students participate in here at PHS. TVOC shows teen drivers how to navigate difficult situations with hands-on experience. In the clip you'll see here, our student is learning how to fall off the road and get back on without overcorrecting, ensuring the car is not flipped or spin out of control. Let's take a look.
Forcing off the road. Now look where you're going. Keep it at 25. Maintain at 25. Make you turn. 25, 25, 25. Don't slow down. Don't slow down. Don't slow down. Drive off. Take your foot off the gas. Drive back up. Go down. Turn around like I did. Use all of your pavement down here. Make you turn. Turn this rascal around. Look where you're going. Accelerate. Punch it. Get to 25. Then run it off the road over here. Run it. Run, 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 run. There you go. Now drive off. Alright. Come back over here on the left side over here. We don't want to get towards the way. Alright. We're going to go around next time at 35 miles an hour. Okay? Don't bite your lip off now. There you go. Give me 35. Maintain 35. Make the turn. Maintain 35. Go off the road. Maintain 35. Reel it off the gas. Turn it back up. Now start slowing down. Make the turn. As soon as you make this turn, accelerate. Punch it. Go. Punch it. 35. Drop off the gas. No brake. Now steer off to the left. Remember the keys to this is, once you get your speed, and then no gas, no brake once it goes off the road.
Yes.
You don't no brake until you get back on the pavement.
Yes.
Do it again at 35 when I take it to you.
In the next clip, another student practices activating the anti-lock braking system in case they have to stop quickly. This keeps everyone involved safe and sound. Another program in our community is the Cycle Clap campaign. It was started by some of our students a couple years ago as a motorcycle awareness program for drivers of any age. Check out this short clip for a more detailed explanation.
We all see them, hear them, know them, the freedom riders of the road. We applaud musicians, beauty, and talent. But what about them? Daring to be bold, daring to be free. But it's up to us to keep them safe, to make sure they're seen. Nearly all drivers who hit a motorcyclist say the same thing. I just never saw them. And what if the solution was as simple as cycle clap? One clap anytime you see them near. It's a fast and easy way for the driver of your vehicle to be aware and save lives. Let's set the trend together to be cycle clap safe. Now, I'll ask you, who do you applaud for?
We hope you enjoyed these short clips showing you some of the activities that we do at Pepperell to really reach out and make sure that students know how to drive safely and how to be aware of things around them, like motorcycles and like other obstacles. All right, thank you guys so much for watching, and we hope you learned something and you had a good time.
Hello and welcome. My name is Emberlyn Bonner, and I am one of the TDS Teen Advisory Board members with the Teens in the Driver's Seat program. Our presenters today are Morgan and Glenn. They are public health fellows with the Association of Schools and Programs of Public Health. Morgan is a second-year ASPPH Public Health Fellow at NHTSA's Impaired Driving Division. She brings a public health focus to impaired driving programs and initiatives. Prior to her fellowship at NHTSA, she attained her master's in public health and maternal child health and epidemiology from St. Louis University's College for Public Health and Social Justice. And Glenn is a first-year ASPPH Public Health Fellow at NHTSA's Occupant Protection Division. She brings a public health perspective to occupant protection programs. Prior to her fellowship at NHTSA, she attained her master's in public health and environmental health from Emory University's Rollins Schools of Public Health. Please help me welcome Morgan and Glenn.
Hi everyone, I'm Morgan.
And I'm Glenn.
And we are ASPPH Public Health Fellows at NHTSA, and today we will be presenting a presentation titled Where Public Health and Transportation Collide. All right, let's get this bigger. All right, thanks for bearing with us there. So quick disclaimer, Glenn and I are public health fellows with ASPPH with placements at NHTSA, but we are not employees of NHTSA or the federal government and do not represent the views of the organization. Today, by the end of the presentation, we hope that you will have gained an understanding of motor vehicle safety, determine the connection of public health to transportation, and recognize major risky driving behaviors, and then to help you find your own role in creating a safe driving environment.
So here I'm going to talk about NHTSA's mission, which stands for the National Highway Traffic Safety Administration. This is where Morgan and I, our public health fellows are. Our public health fellows at, and their mission is to save lives, prevent injuries, and reduce economic costs due to road traffic crashes through education, research, safety standards, and enforcement activities. Next slide, please.
So now we want you to look at this number, 36,096. Take a second to think about, what do you think this number represents? So 36,096 is the total number of traffic fatalities on US roadways in 2019, so in just 1 year. Another way to conceptualize this is to think about being at a baseball game at a large stadium like Globe Field, where the Texas Rangers play, or Fenway Park, where the Boston Red Sox play. And each of those stadiums holds just over 36,000 people. Now imagine you're in the stands, you're at the game, it's in the 9th inning, the stands are packed, there's a lot of people, a lot of cheering, it's super loud, and all of a sudden, everyone's gone. It's just you left in the stands. What does that feel like? What do you think the atmosphere is like? It's probably pretty quiet, probably somewhat eerie. And this is another way we can think about what is 36,000 people, because that's a lot of people. And that represents the total number of people dying in traffic crashes every year. And if all of a sudden you're at a baseball game and all the people are gone, that's kind of what it looks like when we say 36,000 people have died in traffic crashes in just 1 year. So another number to consider, 2,121. What do you think this represents? So this is the total number of traffic fatalities among teens, 15 to 18 years old in 2018. And each one of these lives we know we can save and prevent from dying in traffic crashes.
So every hour, every minute, every second, someone is dying from a car crash death. So car crashes are one of the leading causes of death in the United States. And this is why this is a public health issue. Public health issue defines as something that is affecting the health within our communities. So this is why this is an important, I guess, cause to be focused on. Next slide, please. So here, this is a chart from CDC, and it's showing the 5 leading causes of death within the United States, their latest data, 2019. And I know there's a lot going on within this chart, but we just want to bring your focus to the blue boxes and where the arrows, yellow arrows are pointing. So within the all age column, it's pointing to a blue box, unintentional injuries. So unintentional injuries defined as injuries that are unplanned or preventable. An example of an unintentional injury are car crashes. So unintentional injuries are the 3rd leading cause of death within all age groups. And now we bring your attention to the other arrow pointing at the row, the first row, where it's pointing at the age groups. So between the ages of 1 to 44, unintentional injuries is the #1 leading cause of death within this age group. Next slide, please. So unfortunately, car crashes is the #1 leading cause of death within ages 5 to 24. So as you can see from this visual graph, it shows you that within this red box, it represents motor vehicle traffic crashes, which also stands for car crashes. And it is the leading cause of death within that age group. So unfortunately, car crash takes away the lives of children and young adults than any other leading cause of death within the United States. And we don't bring up this information to scare you guys. So I know death is super scary, but it's more to bring awareness to the situation because you guys are our future generation. And we want to protect you guys any way that we can, especially from car crashes. Next slide, please. So how is the US doing compared to other high-income countries in regards to car crashes? So within this graph here, this little visual, is basically comparing the United States to other high-income countries. Unfortunately, the United States leads in car crash deaths compared to other countries. So if you see from the graph here, Canada is 3rd, New Zealand is 2nd, and the United States is 1st in regards to having the highest rate of car crash deaths. Next slide, please.
All right, I hope you guys have a little bit of a better understanding of the scope of the problem we're experiencing with traffic crashes. And something that you might not be as familiar with is what exactly is public health and how does that relate to traffic safety? So we wanted to give you guys a little bit of an understanding and the definition of what public health is. So it is the science of preventing diseases and injuries, prolonging life, and promoting health through organized efforts and informed choices of society, organizations, and communities. So traffic safety, you might also think of things like road safety or motor vehicle safety, transportation safety. All these terms really are encompassing the same thing, which is to create a safe transportation environment for all road users. When we talk about road users, we're talking about the drivers, passengers, bikers, pedestrians, e-scooter users, skateboarders, anybody that is utilizing the roadways, not just the drivers of those vehicles, but it does include them. A way to think about traffic safety is to think about the 4 E's. We define those 4 E's as engineering, education, enforcement, and EMS. So engineering is all about constructing safe roadways, designing them in ways that are safer for road users. Also, you can think about the manufacturing of vehicles and installing safety features like seat belts and airbags. Our second E is education. It's about teaching people about risky driving and how to have safer driving habits. Something that you might be familiar with is driver's education. Our third E is about developing laws and policies and then enforcing those laws and policies on our roadways and ensuring there are specific consequences, like having speed limits. And if someone's driving above the speed limit, they can get a ticket and have to pay for violating that law, or it could be impaired driving or seatbelt use. Those are different types of laws that we need to enforce on our roadways. Our final E is emergency medical services, or EMS. This is our incident response. So when there is a car crash, there are medical professionals who come to the scene and can tend to anyone that might have an injury. Now, public health and transportation, they come together to prevent motor vehicle crashes, promote safe driving behaviors, and educate the public about risky driving behaviors.
So you may be wondering, how is public health applied within traffic safety? So we're going to give you a quick example. So this is the public health approach. It's utilized within the public health field, and is also applied within the traffic safety field to enforce prevention. So I'm going to briefly explain how it's applied within NHTSA. And so we're going to start with step 1. So step 1, we're trying to define the problem. So car crash data is gathered and it's analyzed for any form of trends. So an example of a trend would be ejection rates. People aren't wearing their seatbelts, so they're being ejected out their cars. And the number of ejection rates has increased tremendously, so we're trying to figure out why. So the second step, we're identifying risk and protective factors. So the research is performed to determine the risk factors and what people can protect people from those risks. So an example of determining a risk factor, it would be determining why people are getting ejected, why there's like a high rate of ejection rates, and what can protect people from being ejected out their vehicles. The third step is to develop and test prevention strategies. So this is where the action happens and programs are developed and tested. So an example of this would be creating a program that encourages people to wear their seatbelts, because seatbelt use actually prevents you from being ejected out your car if you're involved in a car crash of sort. And the next step is the fourth final step to assure widespread adoption. So if the program that is tested, if it's effective, the knowledge is shared and programs are implemented within communities throughout our nation. Next slide, please. So here we're going to talk about the social ecological model and transportation safety. And I know this is a bunch of jargon, but I'm going to break it down for you a little bit. So in order to prevent car crashes, we have to understand the level of influence within that person's life. So we have to understand the individual, relationship, community, and societal factors that affects a person's driving behavior. So promoting safe driving behavior requires like a multi-dimensional approach. And this is where the social ecological model comes into play, basically this picture right here. So at the individual level, the goal is to encourage like a positive attitude towards safe driving behavior by increasing their knowledge and their skill in regards to safe driving practices. However, we have to influence that individual's close circle to influence their driving behavior. So the goal is to influence the relationships around that person. So an example of that would be teen driver safety campaign materials, geared towards parents, so parents can properly teach their children or teens how to drive safely and practice safe driving behaviors. So at the community level, just remembering that the social levels affects that individual's driving behavior as well. So the goal is to influence that level. So an example of this would be implementing teen driver safety campaign within that individual's high school. And the last step is the social level, which focuses on creating a social norm within that individual's environment. So the focus is creating a positive social norm towards safe driving behaviors. So this is where your laws, policies, and vehicle system regulations come into play. And an example of this would be seatbelt laws, texting and driving laws, to make it a social norm to wear your seatbelts and to not text and drive. Next slide.
Great. So the tip of the iceberg when we're talking about traffic crashes is fatalities. It's the most severe consequence of a traffic crash is going to be those fatalities. And like we talked about, there's over 36,000 every single year in just the United States. But it's not the only thing we're trying to prevent. We're also trying to prevent injuries that occur as a result of traffic crashes, which can affect someone's quality of life. And it's estimated that there's 3 million traffic crash injuries every single year, which is significantly more than just the fatalities. Also, costs are something that is also associated with crashes that is huge. It's estimated that it's $75 billion per year in costs related to those traffic crashes. So we want to work to reduce fatalities, injuries, and costs, all three of those things. Now we're going to work through a little bit of a scenario, and I want you to think about these two terms, crash and accident, as we work through this scenario. So I want you to imagine it's after school, you're hanging out with your friends, maybe you're going to walk to get ice cream or grab some food with your friends, or maybe you're driving there, someone has their driver's license and you're riding along with a friend. You notice while you're driving or you're walking, you notice up ahead, there's a police car pulled over to the side of the road with its lights on, and you're wondering what has happened. As you get closer, you realize that two cars have collided. There seems to be a lot of front end damage, and just as you're passing, an ambulance rushes up to the scene and leading you to think that there's probably some injuries of the people involved in the collision, but you aren't quite sure if there was. But really what we want to ask you is, what term are you using to describe this collision between the two vehicles? Are you saying car crash or car accident, or motor vehicle crash, motor vehicle accident? Are you using crash or accident? And it is important. We really want to encourage all of you to utilize the term crash over accident when describing a collision between vehicles. This is because crash implies that this was preventable, and we know that the majority of car collisions or car crashes are preventable things that we can work to create safer driving habits and safer vehicles and roads to reduce the amount of crashes that are experienced. Whereas accident almost implies that this was inevitable and it was bound to happen, which we know just isn't the case. So how can we reduce crashes, injuries, and fatalities? Well, we can work to reduce risky driving behaviors. Risky driving behaviors include speeding, reckless driving like driving through red lights, driving impaired by alcohol or other types of drugs, distracted driving like using your phone or other technology while you're driving your vehicle and not paying attention to the road. Also, in addition to reducing those risky behaviors, we really want to encourage all passengers, drivers, whether you're in the front seat or back seat, to wear your seatbelt at all times, because no matter what position you are in the vehicle, it can save your life if you are involved in a traffic crash. So to help you make the safe decision easy, we came up with a few things that you can say and implement into your own life to create a safer traffic environment for yourself and those around you. So those things include saying and doing things like, I will buckle up every time in every seat.
I will eliminate distractions while driving.
I will not ride with someone who has used alcohol or another drug and designate a sober driver if I'm impaired.
I will drive for the conditions at hand.
And I will know the laws in my state and follow the rules of the road. So some ways you can get involved in your community, you can start by being involved in programs like this that is happening throughout the entire month of May, Teens in the Driver's Seat. You could start or join a Students Against Destructive Decisions, or SAD, chapter. They are a national organization and have lots of different chapters across the US. You could work with your school or youth group to develop a safety campaign. You could partner with local organizations like insurance companies, DMVs, DOTs, driver's education programs, police agencies. A lot of different agencies and organizations are invested in traffic safety and would love to partner with youth. And you could also create a pledge for students in your school. For example, you could start something around having students pledge that they won't text and drive or use any sort of technology like that while driving that could distract them from the road.
Other ways to get involved are through campaigns. There are awareness campaigns and national campaigns that you can get involved in. And some that we have listed as NHTSA's Teen Awareness Campaign. They have the OMG, which is for distracted driving, Muscle Car Extreme, a seatbelt use campaign, and another one is Rules for the Road. And also you have national campaigns such as National Youth Traffic Safety Month, which is in May, National Teen Driver Safety Week, which is usually in October, and National Distracted Driving Awareness Month, which is usually in April. So there are many ways to get involved.
Great. So if you guys have any questions at all, please reach out to Glenn and I or type those in the chat and we can answer those for you guys. We would love to hear any questions you have and be able to answer those for you. If you have questions later on, feel free to reach out to us. We're both on LinkedIn, or feel free to email us too. We would love to connect. But we really thank all of you for listening to our presentation and hope you learned something about how public health and transportation can work together.
This is Nikki Fletcher with the TDS Teens Advisory Board. A quick thank you to our presenters and to you for attending this session. Congratulations to the prize winner. You will receive your gift card in the email used to register for the summit. A recording of the session will be available tomorrow. And don't forget to take the survey. Have a great rest of your day.